Good morning, everybody. My clock says 10 o'clock, so I think we'll get started. I want to thank you for joining us and welcome you to the fourth session in our 5-part Recruitment for Retention Academy series. Today's topic is marketing on a shoestring budget. We'll go through some free and low-cost tools to tell your story. My name is Shannon Studden, and I am here as a consultant, once again, supporting the Delta Region Community Health Systems Development Program, which is providing this webinar today. The Delta program, as I'm sure everybody on this call knows, is funded by the Federal Office of Rural Health Policy in collaboration with the Delta Regional Authority. The webinar today is being recorded and it will be posted to our website. Caleb Lazinski will send the recording and the slides to all participants. Caleb has also just put a link in the chat box that has the slides for today. And he will also be sharing a link to a handout that you can refer to during breakout discussions today. So just like on previous sessions, we'll pull that up again just before we put you in breakouts. But if you're somebody who likes to get access to things in plenty of time, feel free to click on those links and pull up what you need. As always, we encourage questions and discussion. So feel free to unmute yourself and ask your question or make your comment out loud or use the chat box. But we do ask while you're not speaking and while we're all together in this big room, we ask you to keep yourself on mute just to cut down on any feedback. Just like the last 3 sessions, we'll be putting you into at least 1 breakout session today, maybe 2, so that you can have some smaller group conversations with your peers. And of course, when we do that, we ask you to unmute yourself so that you can speak to the people in your group. And if you've got the bandwidth to do so, to turn your video on so that people can see your face. Gwendolyn, it's nice to see your face. I see your video on right from the beginning. So before we get started, please take a minute to find the chat box and type in your name and your organization. That helps our presenters get a feel for who's in the meeting today, and also just helps everybody who's here know who else is here. So as I mentioned, this is a 5-part series. The topics for each session are shown here on this slide, and the first 4 sessions are led by our partner 3RNet, the National Rural Recruitment and Retention Network. And if you've been on previous sessions, this will sound familiar to you. So the last session, the session that we're going to do next week, is a little bit different. So rather than having a formal presentation, that session will be made up of some informal presentations and some small group discussions that are designed to help you learn and share with others any challenges and successes that you've had related to the topics that we're covering in this series. The great thing is we asked for input from you and we got really good input from you on the topics you'd like to discuss during that last session. And we used that input to develop a final plan for that session. So here's what it'll look like. We're gonna, as I mentioned, we'll kind of intersperse some informal presentations with small group discussions. So we're gonna start with our very own Randy Stembridge from Grove Hill Memorial Hospital. Will share some of his experiences and thoughts about behavior-based interviewing practices. And that was mentioned a couple of sessions ago as as a good strategy for hiring. Then we'll have Darla Eder and Jennifer Barber from Sparta Community Hospital in Illinois will join us to share how they have been approaching onboarding, both for staff and specifically for leaders who come on board. Then we'll break you out into some discussions with your peers specifically around these topics. So what are your challenges and what have been your successes related to recruiting and onboarding? Then we'll come back together and Sarah Kelly from St. Genevieve County Memorial Hospital in Missouri will join us to share how they approach performance management. We've heard a lot of talk in the last several sessions about just the importance of culture, and just to have Sarah is going to join us just to help you think about performance management as a way to kind of strengthen and share and solidify the culture that you're looking to drive in the organization. After Sarah has shared, then we'll do another breakout session specifically around performance management and anything else related to engagement and culture and things that you're challenged with and things that you've had success with related to these topics. So Randy, Darla, and Jennifer and Sarah have really generously volunteered to take time out of their busy schedules to share their approaches with us. And I am just so appreciative and really excited that they'll be here with us next time. Before I hand things off to our speakers today, we're going to ask you to respond to 2 poll questions. And just like before, we'll ask you the same questions at the end of today's session so we can measure the knowledge gained today. So Caleb, would you pull up those questions? So the first one's about your understanding of successful strategies for creating job postings. All right, so we've got the vast majority of people saying somewhat confident, and we have a couple folks saying neutral. Okay, we'll see if we can move that needle before the end of the session. Thanks, Caleb. I'm gonna pull up the next one. This one's about telling your virtual story through web presence and social media. All right, Caleb, you can close that whenever you're ready. So a little bit more distributed this time. We've got about a third of people pretty confident, a little more than a third somewhat confident, a little less than a third neutral. Thanks, everybody. We'll take a look at how these numbers stack up at the end. So I'm going to take just a minute to introduce today's speakers. Today we have Christine Morin and Mark Barclay will be back with us. So Christine is the Director of Communication and Marketing for 3RNet. Christine leads the development and production of all organizational communications, coordinates and implements all marketing efforts in collaboration with her 3RNet colleagues and members, and oversees the activities of the 3RNet Marketing Committee. So we know our 3RNet partners all wear many prior to joining 3RNet. Christine worked for a public relations firm in Las Vegas, where she coordinated marketing efforts for clients, varying from local firefighters to international artists. She also worked as the communication coordinator for the North Dakota Center for Rural Health, where she led the communication efforts for many grant programs. Christine has master's and bachelor's degrees in communication, both from the University of North Dakota. She works from her home in Henderson, Nevada, and was born and raised in rural North Dakota. We also have, as I mentioned, Mark Barclay back with us today. Mark is the Director of Member Services for 3RNet, and in this role, he serves as the primary support contact for 3RNet members and the over 5,000 rural and underserved facilities across the country that use 3RNet services. Prior to working for 3RNet, Mark recruited for 36 critical access hospitals and 4 federally qualified health centers as the workforce specialist at the Center for Rural Health at the University of North Dakota School of Medicine and Health Sciences. That's a mouthful. Mark also helped establish TrueServe, a web-based tracking system used by state offices of rural health and primary care offices nationwide. In 2013, Mark gained certification as a fellow of the Association of Staff Physician Recruiters, their highest recognition. Mark has a bachelor's and master's degree from the University of North Dakota. So Christine's going to kick us off today. Christine, I'll turn things over to you to get us started, and I will stop sharing my screen. So thanks for being here.
Thank you so much. Hello, everyone. Good morning. It's early here on the West Coast, but I am so excited to be with you all here today. I'm just going to share my screen. I really appreciate you taking the time to be with me this morning. And I always kind of get a kick out of hearing my own bio. That's sort of a bizarre thing because it makes me sound fancier than I think I really am. So I've been with 3RNet for over 7 years. And like Shannon mentioned, we do wear many hats. And I was a little intimidated by the poll because I think some of you may be more well-versed at sharing your story virtually than we are. So you may have some tips and tricks for me, but really what I want to get across today and share with you all is I do wear many hats. We do operate with a shoestring budget. We are a very small nonprofit organization. We're a staff of 4, soon to be 5. And so really, I'm just going to share what's worked well for us as a national nonprofit, kind of in this sphere of recruitment and retention. And another really exciting thing today is we are right in the middle, very, very close to launching new branding and a new website for 3RNet. And so when I submitted my slides back in June, I was hopeful that this would be kind of our first presentation with the new website, the new slides. The website is still 2 weeks away, but we're on our final countdown. But you all get a new kind of sneak peek at our new branding, which we're very, very excited about. So if you've been on the previous sessions and this looks a little bit or a lot different, that's why. But again, my name is Christine. I'm so excited to be with you all here this morning. Please feel free to share any questions, comments in the chat as we go along. I will try to monitor that as well. And with that, we will get started. Oh, maybe we'll get started. There we go. So a little bit about 3RNet. So we are the nation's most trusted resource for health professionals seeking careers in rural and underserved communities. And we have the very good fortune of being powered by our national network, the National Rural Recruitment and Retention Network, since 1995. So in terms of job boards and looking for a job on the internet, I always feel a jolt of pride that we've been around since 1995, because for most of us, myself included, I don't think I even knew what the internet was in 1995. I think that's more the era of Katie Couric asking her producer, if you've seen that famous clip from the Today Show, what's the internet? I think that's where the majority of us were in 1995. So we've been around a long time. And again, we are powered by our national network. We have 3RNet network coordinators. If you've sat in the previous sessions, we've maybe called them members. This is something with sort of our revamp, our rebranding. We feel the term network coordinator is more correct and more inclusive of what our folks do, because they really are the outreach to all of our rural and underserved employers, job seekers. They connect with those, what we call mission-minded health professionals. So someone who really has a heart and a passion for working in a rural or maybe even urban underserved area. They form our nonprofit member association. So we are a membership association, which I think is pretty cool. And each of our member organizations is unique. So we have representation in all 50 states. We also have a couple federal partners who have a membership with 3RNet. So the VA, IHS, a couple of our other unique memberships I always like to throw out there. The Northern Mariana Islands, way out in the Pacific, past Hawaii, on your way to Japan. They are a member of ours. So we are vast and we are diverse, but we all have one mission. And that is to improve rural and underserved community access to quality healthcare through recruitment and retention. So our main services include our job board. I'm sure you've heard about that. We have so many changes coming to 3RNet. If you've ever used 3RNet in the past, I would say starting August 2nd, you've never used 3RNet, because it is built sort of from the ground up. Not only is it going to look different, it's going to act different, and we are really proud and really excited about what we've got coming your way. Education, like we're doing today, so we do a lot of that. And although I'm talking about marketing, I'm talking about it with the goal of recruiting for retention. So that's something we feel really strongly about. Everything we put out there, we build around our core philosophy of recruiting for retention, because it's not just a warm body we want there, right? You guys work way too hard. You do too many things. Your resources are too limited for you to not make the most of what you're putting out there to find the right fit, the best person for that role. So that's really important to us. And our impact is something I always like to highlight as well. If you'd like to go back and take a look at our most recent annual report, again, we're a staff of 4, soon to be 5. We're adding a new staff at the beginning of August, which we're also very excited about. And really, with our grassroots effort of our national network, we have financial impacts in the millions and billions. I'm sure you all know the impact of adding one physician or one dentist or one provider or one health professional. And I always feel really proud of the impact, people wise, our small organization is able to have nationally. So today, again, you all may have just as much, if not more, expertise than me. And I'm okay with that, because I would love to make this more of a conversation than a one-way talk. So really, again, what I'm going to share is free and low-cost resources that we've tested, that I love. And my theme is working smarter, not harder, to maximize your precious resources of both your time and dollars that you have available. My goal is for you to have some, walk away with a few. I'm going to throw out a lot of things we've used, a lot of things we've checked into, a lot of resources we've tried. If you walk away with 1 or 2 or 3 items you can easily add to your list, feel like you can incorporate into your workload and implement, and you feel like, oh, this might make this part of marketing or this part of a promotion so much easier, that feels like a really good use of my time, and I hope it is of yours as well. And really, that's my goal today. So I'd like you to kind of have that in your mind as I continue on here. When we think about marketing, when we think about all of what can go into that, we have so many options available to us today. What's the one thing you wish you knew a little bit more about, or had a tool, or had a trick or a tip? Have that in your mind, or maybe we'll come across one as we carry on. And if at the end we haven't addressed that, let's make sure we address that. So our first poll question: where or when does a potential employee have their initial perception of your community? So I'm going to launch this poll. So our options are driving into town, postcards or another mailing you might do, or searching online. All right, we've got a good mix. So thank you for participating in that poll. And I would advocate that in today's day and age, online would be maybe the first and foremost way many people get that initial perception of your community. I would also advocate, if they are local, they maybe know the community, but they may not know you as an employer. And so their first step in the job search process, even if they are local, will likely still be online, which works out well because that is what we're going to talk about, are some website and web cheat tools. Okay. So again, if you'll bear with me and let's make the argument and go with the assumption that when someone's looking for a job, they're considering you as an employer, they're looking at your community, online is the first, interaction they have with you and your first impression. So I won't spend a lot of time on this, but just in general, writing for the web, excuse me, make sure that it's professional if this is your first impression, casual, conversational, enthusiastic. If you're wanting to hire someone, you're wanting to draw them in. If you love working there, share that enthusiasm through your writing. Make sure you chunk it. The internet has made us lazy readers, myself included. And so we're easily scanning pages for the answer we're looking for, right? We're not inclined to read a lot of huge amounts of content, and make sure you have a variety of content as well. More important, I want you to all think about how or do you think of your website as a recruitment tool? So using those same principles, writing casually, being enthusiastic, I'd encourage you to really take a deep dive and look at your website, look at how is that, or is it being leveraged as a recruitment tool? So a few things you might consider: showcasing your providers, your health professionals, the folks who live there, and someone who's looking for a job or considering you as a potential employer. What do their peers say? Do their peers enjoy working there? All those sorts of things. Who are your customers? What's your service population like? This is another place I'm sure you've heard in previous sessions, the importance and the value we feel of having a recruitment team. It's definitely beyond one person, but here's a great way in looking at your website where you can harness the power of your recruitment team. So, if you've got a local banker on your recruitment team as part of your board or your recruitment team, what would they say? If you've got someone who maybe works in tech or has more of a that sort of angle, maybe they'd be helpful. Maybe you have someone who's new to town or a spouse who's new to town. Maybe they could answer some of those questions that may seem obvious to you, but if they're newer to the area, oh, I wish I would have known this, or I think you should share this. So in general, more minds can be better than one. Probably the most important question or the most important thought here: what is your application process like? This is something we see over and over and over, and we're in a competitive space, right? Recruiting health professionals is no joke. I know that you all are putting in countless hours. You're putting everything you can into this, and I'd hate for the hurdle or the hiccup in this process to be the application process. So some things we encourage folks to do, maybe start or consider having a simpler or more simple intake form. Do you really need a full application process or an application to start? Can you gather a few things, maybe their name, email, what profession or license do they hold? And then maybe you can follow up. Not only will that make it easier for them and potentially eliminate a hurdle, but maybe it'll feel more like intimate or custom, or like you guys, you really care, you really want me. I just filled out that form. That was super easy. And then I got this email from someone at the hospital, and it really felt like a conversation. It felt like from the first interaction or second interaction, they really wanted to get to know me and wanted to make this easy and really wanted me to be part of their team. Again, another question here: how easy is all of this? So sometimes what we see with an application process, it might go something like, I go to your website, I go to jobs or careers. From there, I maybe see the job listings, I click on one, and then I have to, maybe it's a PDF that I have to download, print, scan. I would say myself as a millennial, that feels like a lot of steps. People may not even have a printer, right? If they're a young person and they're doing a lot of job searching on their phone, maybe they do, but just one more step, right? So anything you can do to make this easier, that's sort of the thought I want to provoke here. So think that through, because your website, I know it's a powerful patient and customer tool, but don't discount its importance as a recruitment tool as well. Another thing I wanted to just talk through about websites, think about how and where your marketing flow ends on your website. So we're going to talk about ads, online ads, social media. When we get to that, I want you to kind of think, and you'll have the slides so you can circle back to this. But if you have an ad, what does that ad say? What is the clear call to action? This is something I bet we say call to action every time we're talking about something marketing or promotion related on Net, because we always feel like we have so much good information, we have so much to say, we have so much to share. But at the end of the day, what's the one thing, the one action you want someone to take? And that hurts me as a communicator, but it's realistic, right? So what do you want them to do? Where do you want them to go? What is that call to action? And then just think through this flow. So for example, maybe we have a Facebook ad. Maybe the call to action is get started today, start your application now, and then have that call to action link. Where does that go on your website? So in addition to thinking through the process on your website, if you want to add one more layer to this, if you're doing external ads, just make sure you think through this piece as well. All right, so I know for me, it feels like as much as I proofread, as much as I try not to have a spelling or grammar error, as soon as I hit send, I notice something. And so if you're like me and you want some tools to make that a little less scary or daunting when you push send or publish something, here are some writing editors. Hemingway editor is very popular. Grammarly is one that you can just simply add on to your Google Chrome browser. So if you go to grammarly.com, that's very easy to figure out. And readability score. So if you want to make sure that it's easy for an average person to understand, that can help with that. And those are all free tools. Again, I mentioned earlier, maybe someone is looking at your jobs, trying to go through the job application process, even on a phone or tablet. If you're not sure and really are detailed and want to make sure, how does our website look? I'm on a desktop myself all the time. And so sometimes on Net, I have to pull out my phone and actually, go through and see, okay, well, it looked really good on my big desktop, but what does it look like on a phone? And I would say this is an easy thing to check off your list, just to make sure, one, things are looking okay, and two, most importantly, they're working as they should. Again, we just want to make sure we're not adding any unintended hurdles or loops for folks to jump through. I mentioned earlier, if you have an application process, it's a bit cumbersome perhaps, or just feels maybe too much for what you need for that initial intake, I did want to share this tool. Jotform is really cool. So bear with me here as I've got lots of things pulled up. But this is jotform.com, and this is a free tool. And what I love about Jotform is if you just go to the website, jotform.com, on the left-hand side here, you'll see they have all these different templates that someone has already created. And so I was thinking they have applications, they have a registration form, they have surveys. a contact
Christine,
form.
we're seeing your slide. Is there?
Oh, are you?
Yeah.
Thank you. Okay. Let me stop share. Share screen. Desktop one. All right. How's that now? Are you seeing it?
Yeah.
Perfect. Thank you. Thank you for speaking up because that's not helpful to anyone. Okay, so here we are on Jotform's website. Again, on the left-hand side, they have all sorts of templates built. So they do have application forms. If you don't have a web form version of an application, someone's already built some options you could steal for free. And there are even a contact form if you wanted to make it more simple. So you simply can go through these. You can see here's an employment application form. You can preview it or you can use template. And you can easily plug these into your current website. So take a look at that. Again, these are free and Jotform is really, really easy to use and really slick. Okay. Social media content. So in addition to your website, I also want to talk about social media because it's out there, it's where people are, sometimes probably more than we wish. It's all we talk about, isn't it? Especially with COVID and having an election, there's all sorts of social media stuff happening in our world. So another poll question, I just want to get a sense from you all right now, do you currently see social media as part of your recruitment strategy? And Caleb, thank you. Fantastic. I like the variety in the responses. This is the most variety I've ever had with these poll questions. So thank you. So I'm glad to see a few folks are already doing this. I'm also very glad to see that some of us aren't quite sure. Some of us maybe see the potential, but still have some questions. I would say that's where I would lean or would have leaned more with this question. So I'm right there with you. So I'm going to ask you folks who are sort of on the fence. I'm not going to ask. I'm going to make my case quickly for social media. One reason we use it, and we really, with our rebrand and our launch of our new website, we are sticking a lot of resources into social media. And the reasons why are, I'm a marketing person of one, so there's a full-time me, but I'm doing this and 70 other things, just like you guys are. Social media is right at my desktop. It's right in front of me. The cost can be and typically is very, very low, which is important for us as a nonprofit. Most important, as any savvy marketer knows, it is where our audience is. So love it, hate it, toss it in the trash, however you feel about it. Your job seekers, those folks looking for jobs, they are on social media. And so for that reason alone, we can take a deep breath together because I'm with you. It's daunting. I find it daunting. However, I hope that this section in particular, I have a few tips and tricks that will make it feel like not such a mountain to climb. So with the new launch of our website, this has changed a little bit because currently we do not use Instagram, but we will be. And that feels a little bit exciting, nervous for me. But we also use Facebook, Twitter, and LinkedIn. So that's our social media presence. Some of what we share blog posts, we share our job postings. We have some unbiased resources and tools for job seekers, for employers. We have some beautiful photos that we purchased that further our brand. We share events and resources. Most important, what we share, we reuse, reuse, and reuse again. So that is an important takeaway, and I'm going to walk you through some of the ways I do that as we go along here. We're not an employer, we're a job board. So we did a little bit of a dive on employers to see who are some employers out there who seem to be crushing it on social media, and what are they sharing that seems to be working really, really well. The good news is a lot of these align with recruitment and retention. So go us. Services, of course, your job's available. Staff, I think this is really important. I'm thinking in one of the previous sessions, Michelle Varcho probably talked about, you know, the 4 things that an employee, a potential employee looks for, you know, belonging, esteem, you know, will I be respected? Will I belong? Will I feel valued? If you are able to share some staff who do feel that way, that is more powerful than any ad or anything you or I could ever put together. Reviews, fundraising opportunities, and of course, sharing trends and topical information. So that can be an easy way to kind of kill 2 birds with 1 stone. Not only are you sharing important information for your patient and customer base, but you're showcasing yourself as a local expert. You're engaged in the community. You have a presence online. I can see as a potential job or a potential employee, excuse me, that you guys are on it, and I can get a glimpse free and easily of what you're putting out there. And I wanted to share with you an example. This is one we found. So this is Bay State Health. They are in the New England region. But what I like about them is you'll see they have a staff featured right here. And I just thought this was so cool. Again, kind of what I was talking about just a minute ago. I mean, this is something that this social worker, Caitlin, put together. It's her story, it's her experience. I see COVID in here, so talk about timely and topical information. So it's not even a super fancy photo, it's just a simple selfie. But what a way to give us a personable glimpse into this organization. And here's some COVID vaccine clinic information. I won't go too far into this because I'm sure I'm already behind on time. But they just do a great job. You'll have to go in on your own and kind of check out what they've got. Here's, should you consider bariatric surgery? So again, nothing too earth-shattering, right? But it's good content. And so again, the link is in the slides here, so you can check them out. And there are others. You all may be one of them. And I'd love to see if you have a good example. If you want to share that in the chat, that would be great. But I think that's what I wanted to share to this point. And are we ready for a breakout?
Yeah, let's take a couple minutes to have a breakout discussion. So Caleb has just put the handout in the chat one more time, just so you can have the questions for your breakout discussion in front of you. And just like last time, if you get in there and you talk about this a little bit, but there's some other burning issue that you'd really like to ask your colleagues about when you get in the room, feel free to go off script and just talk about anything that you want to talk about. But the questions that we have for you in this breakout are related to what Christine went through. So first of all, just to start by introducing yourself, you may know your your group members by now, but just tell them who you are and where you are. And then just to share a little about your thoughts about your website. So how effective is your website as a recruitment tool? What does it do well? What could it be? How could it be even better? Where most of your candidates find out about you, and how you use social media, if you do. So just anything that you can share about how things work right now with your organization. So Caleb, I think we are ready to go into breakouts. We'll spend 15 minutes in breakouts, and we'll come back at 10:55, and we'll do a quick debrief. I will ask for at least one highlight from each group. So be ready to share, have one person share, whether it's in chat or out loud, just one highlight from your discussion. And we're back. Welcome back, everybody. So again, we'll just ask each group to share just one highlight of your conversation. So would anybody be willing to unmute yourself and share? We had in room 1, we had Nicholas, Randy, Roby, and Tabitha. Would one of you be willing to unmute yourself and just share one highlight?
I'll just take a stab. I have hated social media for multiple reasons. I don't have a personal Facebook account, and I probably never will, but I'm having to change my attitude because I'm learning some good things about Facebook. So thank you for that encouragement. And so Tabitha, you can shut yours down and we'll put ours up.
Thanks, Randy. What about the other group? What's one highlight from your conversation?
Hi, Shannon. This is Sherry. With our group, we talked about that we both have websites. Our institutions are very similar, but we both use Facebook, but in a little bit different manner. They have a Facebook page where we do not, but I share things on my personal and get that out and share it. Staffing is an everyday worry. We're also doing sign-on bonuses and even paying extra per hour just to get people to cover those critical shifts.
Thanks, Sherry. Yeah, staffing is just such a challenge right now. And good for you for keeping the hospital alive on your own Facebook page. That takes a lot of effort. So good for you. And I know that Christine's got some additional good social media tools to share with us. Thanks everybody for sharing. It's just nice to hear kind of what came up in your conversation. Christine, I will turn it back over to you.
Thank you. And thank you for letting me join one of the breakout groups. That was really fun. I was encouraging, I was in the first group and they were sharing that one of the members of the group said they just made some changes to their website. So now not only can someone apply paper, we were talking about some generational differences, but you can also apply just online really easily. And then a few other folks are making that change as well. And we were just as the breakout ended, we were talking about virtual job fairs and trade shows. We as 3RNet have done some national trade shows. We've had members who have participated in virtual job fairs, and we've heard really fantastic things about interest in rural areas when it comes to virtual job fairs. So Mark, correct me if I'm wrong or mistaken. Practice Link, I think, does them. Practice Match, Career MD, perhaps. So sort of the big names in our space. They're hosting them. If you haven't, might be worth checking out. I know some folks in our group were saying they've had luck. One tip I was sharing as it cut off is that, I think that attendees at those events, they're meeting with so many people, it can be a little bit overwhelming. A tactic we've tried as 3RNet is When we're at a trade show in person, we will have someone fill out our 3RNet registration form. It's free. It takes a minute or two, but a minute or two can feel lengthy in a booth. It can feel lengthy in a virtual environment as well. So as a way to say thank you, we'll give them a $5 Starbucks gift card. And I got to tell you that $5, that is like catnip. I don't know why. I think the instant gratification, they walk away with something. And so if it's a virtual environment, we'll email it, and that's really easy to do with it through Starbucks or any other, Amazon, whatever. But we have had more success with that than, in the past. We had done like a drawing, like register, and you have a chance at even like $250, and people are more apt to go for the $5 than the $250, which is great. So that's something that's worked really well for us. Another thing I wanted to share is social media. I know a few folks said they've promoted jobs on social media. With anything, I know Facebook, if you're promoting an ad or boosting a post, it will ask you if it's for hiring. So just word to the wise. I think you all know this, but I always feel like it's good information to share. Make sure you're not accidentally or unintentionally discriminating by age, gender, race, any of those things. Facebook in particular is pretty good about making sure you cannot do that, I think because they were sued. And if you've tried it on one platform, for example, Facebook, and haven't gotten a lot of bites, I would encourage you to try a different platform. So Facebook and Twitter, Instagram are all pretty similar. So Instagram, Facebook owns, so you can actually run ads on both at the same time, even if you aren't on Instagram, I believe. And so check those out. Cost-wise, again, they're pretty similar. I mean, for 3RNet, we're talking $10, $20 here. And you compare that to a medical journal or even a newspaper ad, you get a really good bang for your buck for the prices we're talking about. Another one I would encourage you to look into, it's not my favorite, LinkedIn. It's not my favorite because it's more expensive, but if you're regularly advertising regularly on there, they are pretty good about sending like coupon codes for free advertising. And I think the reason that might be worth looking into is a few folks in our group mentioned social media can be really helpful for like a clerical position, but not clinical. And I always think of LinkedIn as more of a professional social media platform. So again, you'll just have to try, right? It's like what works well here might not work well there. What works well for us may not. But just if that's some helpful brainstorming or ideas, I hope it is. That's some of what we've explored and we've found out in this journey of online advertising we all find ourselves in. Okay, anyway, hopping back into social media, just some other content sources. I won't go into these too in depth, but the idea here is you all are your local experts. If you are the local hospital, the local clinic, even if you have competitors, I'm gonna venture to guess you don't have a lot. And so if you use any of the information from your local, statewide, even national resources, and you can give your own local spin. So an obvious example is COVID right now, right? It's what we find ourselves never out of, especially in rural areas. If there's a blog or information from a good trusted resource, I know this can be tricky. You'll have to find what works and feels right for your community, for your facility. But, if you can share that and maybe say, we've got vaccine available, or if you can have a little video, whatever it is that, you could share your own kind of local take on that. Pre-COVID, the example I always gave was flu shots. Flu shots are back. We've got flu shots at the clinic. Flu shots are here. Get your flu shot. But again, just to kind of share your local expertise, not only is that good content, again, for your community, your patients, it, I think, can be morale boosting if you're asking your nurse practitioner or someone, your phlebotomist, whoever it is, to share their spin on it. They maybe get to be featured. Some of us, some folks don't like that. Some do. And some, you'll find that you have really natural fits and really natural social media influencers right in your own neck of the woods there. That can really be some great content to show those potential job seekers why you are such a great place to live and work. So that's the idea behind these great content sources. And these are some that I really like. So some more content sources. Again, these are more the federal level. If you belong to the National Health Association, they send out emails. They share a lot of good stuff. One that I don't think I have on here, which I should, shame on me, is the Rural Health Information Hub, or RHI Hub. They are fantastic, and they are rural health focused. They are headquartered right there in Grand Forks where Mark is, and they have a lot of great information as well. So something that I like to do, again, it's sort of like what works for you. And just, if this feels overwhelming, find one or two you love. You maybe already follow or have someone you love, or that's your favorite on social media. For the gentleman who said he hates it, I hope you find someone that speaks to you and that can inspire you, because really that's what we're talking about, right? Is if you just need some motivation. That's why I shared the Bay Health example earlier. That's something I find really helpful, because it's like you're sitting down, you're starting to type, and you're like, I don't know what to say. And so if you need a little motivation, if you need a little inspiration, this is a good thing about social media. There is no limit, literally no limit of what you can find out there. The most important part of social media is, how do we make this easier? So my favorite part are the cheats. How do we work smarter, not harder? So here's a polling question just for fun. And this kind of goes back to my earlier thought starter of, our audience is there. So I'm curious what you all think. What percent of our population here in the United States over 12 and over uses Facebook? And we'll have the answer and some fun stats about the behemoth that is social media on the next couple slides. All right. Well, you guys are a very smart group, which I already knew. So I feel like we are mostly correct here. So 63% of the population over age 12 uses Facebook. And that's a lot of people. That's a lot of people just in sheer numbers, but also in consensus. If you think about anything in recent times, it feels like we hear all the time, oh, we're split as a nation. We're pretty 50-50 about a lot of things. And that we have 63% of us are on board with Facebook is, I think, sort of remarkable. So almost all Americans know about Facebook. Fortunately or unfortunately, 2/3 of us use it. That's down a little bit from 2017, but up from 61% of last year. So here's a tidbit that stuck with me, and I just wanted to share this with you. So almost 33% of Facebook's audience is aged 25 to 34. So this is the largest audience segment, and I think it's noteworthy because I would venture to guess a lot of individuals looking for their first job, especially their first professional job, are likely to fit into this age range. So just as we're keeping our recruiting hats on, again, we hire folks of all ages, but I know for some folks, getting that first job can be really, really helpful, or something folks work for or look for. So I did want to just share that as well. So we at 3RNet use a couple tools to make it look like it's just more than me kind of behind the wheel. And I also use a master spreadsheet to organize our content. And I have some older examples that I wanted to pull up here. So this is when I went on maternity leave 3 years ago, because my baby just turned 3 a couple weeks ago. So this is something I put together for my coworker, Michelle, so that she could take over the social media for us. But this is something we use all the time. And so I am not a spreadsheet expert. I'm pretty limited, so please don't judge, but this works really well for me. So you'll see I have the date here. I have what's happening. And so you'll see we have states here. We, with our membership, do like a rotation, a weekly rotation. I have holidays in here. And then you'll see that we have a couple posts. I have the links in there. I mentioned that Bitly is a tool we use, and you can see right here, it's kind of little. Let me see if I can zoom in. No, not that way. Oh, it won't let me. It just shortens the link. So this is something we come across a lot in 3RNet. By the time you get to a specific job posting, the link is really long. And sometimes that doesn't matter, but with Twitter, for example, where we're limited on our characters, that can become problematic really quickly. So there are lots like this. There's Bitly, there's Owly, there's all sorts of link shorteners. You just put in your link, it makes it into this funky looking little guy, but it's shorter or fewer characters, excuse me. So that's helpful to us. And then you can see how you can plan way in advance. Another thing I love about this is, so here's an example of a trade show we went to. So if we did this in 2018, when I'm planning for 2019, odds are, rather than starting from scratch, I would take this post, maybe, switch it up a little bit, but then I'm editing. I'm starting with something, I'm not starting from scratch. And another way I do that, I don't know if I have, here we go, this example right here. So we're always wanting to promote registering on 3RNet. So this puppy, I might take this one, I might copy it here, and I might paste it every few weeks. And as we're talking about reusing, revamping, recycling, you can see how just switching that up a little bit, having maybe a few versions of that, you can see how you can make one post work way harder for you. So that's another thing I do. And again, just a simple Excel or Google or other spreadsheet I've found to be really helpful. And I also wanted to hop over, if I can, to Buffer. So if you've used something like this before, I find Buffer, Hootsuite, there are so many of them out there. I can't even remember them all, but essentially they're a third-party platform where you can plug in your social media posts, and it makes it so you can post multiple places at once. And so I don't have anything in here. I just wanted to have an example. So we have our Facebook, our LinkedIn, and our Twitter linked to this account. So what would you like to share? You can type something like, we have so many new changes coming soon. We can't wait to share them with you. So I select which ones I want to share that to. You can see I can share it now. I can share it next. The real bread and butter to these platforms, I think, is this schedule posts feature, because you can see a calendar pops up. I mean, I could schedule this way in October if I wanted to. So what I typically like to do is sit down, do a week or two at a time. We'll schedule this for today, and look at that. You don't have to log into Facebook and then log into Twitter and then log into LinkedIn. It's there, it's out there, one and done. And you can customize it if you want your Twitter posts to be a little bit different than your others, that kind of idea. So another thing I would mention about these platforms is if you want to try them out, I tried out many of these. They typically always have a free version, which is really helpful if you want to kind of sample them. We got to the point where I wanted a paid version. And for us, Buffer was a really good price point. It's, I think, $15 a month, where some of them like Hootsuite, which is more robust, but it is more expensive. And I liked the amount of content you were able to upload at once as well. There are some other features in here too. There are analytics and engagement. But overall, it's just a really helpful tool, really saves me a lot of time and effort. So I wanted to share that with you all. And if I can get back to my PowerPoint, there we go. Okay. We've talked already a little bit about social media ads. I won't get into this too much, but just please check them out. They're very easy to set up. I promise, if I can do it, you can do it. And they want to take your money. So they've made it easy for that to happen. And again, it really is an easy way to reach a few hundred or even a few thousand people with a shoestring budget. So some time and money saving tools here. Here is a polling question. So are you an early adopter, or are you more of a wait and see kind of person like myself? Are you like, I've got to have the new iPhone, or are you like me and you still got your iPhone 6 that's no longer going to update? Okay. All right, we've got a good mix here, and that's good because what I'm going to share here just in the last few minutes of my stuff is just some things that you don't have to be the early adopter. We've tried it out. So here are some things that have worked really well for us. And I always have to have the missed car phones and VCRs on there for my dad because he also is not an early adopter at all. So Fiverr.com is a resource I love so much. So if you need anything digital created, so you need graphics, you need a video, you need someone to do an SEO audit of your website, which is really technical, but maybe that's where you're at. Their shtick is everything starts at $5. But you can find someone to create just about anything for you. I'm talking from logos to infographics to social media posts, you name it, it is on there. I actually just have a couple orders I have to complete once I'm done with this presentation here today. I absolutely love Fiverr. If you're to the point where you need, maybe you and your team get to the point where you feel you should have your own little separate recruitment or application website, there are many out there like this. One we've used is Weebly. If you're familiar at all with our academy, we have a little academy website. You can just click this link. We built that using Weebly. So we're not talking any HTML. We're not talking any, I'm a website builder. No, it's drag and drop. It's super easy. Canva.com. This is fantastic for social media posts. I do feel like I'm running out of time a little bit, so I won't hop over there. But check them out. Facebook, Instagram, post, banner, photos, anything you want, even email templates. Canva is fantastic. So we talked about way back when we were talking about the application process. If you are set on having a PDF, rather than having it needed to be printed, that whole process, there is a very easy way to make it fillable. Those are the steps, and you do need the Adobe Acrobat or Adobe Pro. TechSoup is an easy way for you to get that for like $5 or $10. We'll talk about TechSoup next. If you need a way to message with your potential job seekers, we talked in our breakout room how us millennials would prefer to text. So if you're finding you have a lot of millennials or younger applying and you need to message them, intercom.com, or Google also has a fantastic messaging tool. So just a note on TechSoup, this is a website for nonprofits. And what I love about TechSoup is you can purchase software at a discounted rate. So we've purchased Adobe, I've purchased even the Adobe Creative Suite, so Photoshop, InDesign, Illustrator, pretty in-depth technology there. But you'll get a discounted license. And I feel like I was just on there, and the Adobe Acrobat, if you want to make a fillable PDF, is like $10 or $15. Also, if you want to make a fillable PDF, I bet you that's something you could find someone on Fiverr to do for you for $5 or $10. Vistaprint, I love me a good Vistaprint coupon. And FedEx, even if you don't have one locally, FedEx Kinko's has a really slick online tool to get signs printed. Do you have a sign saying we're hiring in your reception? And we've gotten pretty professional looking little signs from FedEx for less than $20. Email signatures, do you have, a we're hiring kind of graphic in your email signature? Don't discount that. I don't know about you all, but I send many emails every day. And so that's something as an organization, we try to be thoughtful in, what's our email signature right now? What are we promoting? Again, what's that call to action? Think through that graphic we looked at. If you're not sure how to make an email signature, but want to kind of zhuzh it up, HubSpot, WiseStamp, or even Fiverr are some really cool tools that can help you put your best foot forward that way. Really quickly here, some image and videos. So we just bought a ton of images, but if you're looking for royalty-free stock images, make sure if you're using images, you have the legal rights to use them. Again, if you're using images, make sure you can legally use them. If you need some professional looking photos, these are all really great websites you can check out. If you're looking, you want to maybe pay and get some photos in a little bit more robust way, I guess I would say. Shutterstock, iStock, Adobe are all websites we've used. The sky's the limit. All of the photos in this presentation I purchased from iStock Photos. And so that gives you the legal rights to use them in perpetuity, I guess I could say, and then you you have this beautiful imagery of your own local, what it looks like where you live, and you can share that with the world, which is kind of cool. We talked about Canva, but there are some other ways to create graphics. So this little graphic was something I put together in Canva in 5 minutes or less, I think. And what's neat about Canva is I made this for Facebook, and then I could easily resize it for Twitter, and I could easily resize it for LinkedIn as well. So this 1,194 days was in reference to how long it took for a position to be filled, and they found that this position was filled. They found this person through 3RNet. So one of our 3RNet network coordinators shared with me that email, and that number just like stuck with me. It was like, oh my gosh, I know recruiting can be hard, but holy moly. But they stuck with it and they filled that position, and they were so excited. So that we were able to kind of visualize it in that way. Some image editors. Again, we've tried these out. There's lots there for you. Check those out if you're needing some editing. More and more, we see a demand for video. Here are some options if you're looking into video. Fiverr is also a great tool for video. We just had a pretty cool little intro video put together with our new branding through Fiverr. So check those out. And I think to sum it up, of course, we know we're in a competitive space. We've talked about how hiring it's tough out there right now. And it's one of probably many things you're doing. However, I hope my last hour and a half of rambling eloquently has given you some hope. And again, my goal is you walk away with a few things that feel practical, easy to implement, and free or low cost for you to really put your best foot forward and do all you can with the precious resources available to you. And remember, you're not in this alone. I'm not in this alone, thankfully. And make sure you use your team available to you. One more reminder, again, make sure you use your network. So for us, it's our network coordinators. There's one of me, but there's 54 of them. But you're one person, but you have a staff of how many? You have a recruitment team of how many? So don't discount the importance of those folks as part of your marketing team and marketing efforts as well. And I think with that, Mark, I'll finally turn it over to you.
Thanks, Christine. I think we'll do a quick break in just a second, but before we do, does anybody have a question for Christine? You could unmute yourself and ask it or share it in chat. All right, I think we're at 11:29, so we'll get started again. If you did step away, Christine just put a link in the chat to their new video created through Fiverr for, what did you say, Christine, $30?
I think it was. Yeah, I'd have to look back, but it was not expensive at all. Yeah.
So when you get the chance, everybody, take a look at it. It's pretty impressive.
And I've worked with many different people on Fiverr, and I've always had really good experiences with communicating with them. If it looks like they have something kind of what I want, but it's not exactly, I'll message them. They'll make me a custom order. I'll order it that way. And I feel like, I don't think there's ever been an instance where we've walked away not happy with the product. So if we get it the first round and it's not quite there, we send it back, and we always end up really, really happy. So do check them out if you're looking for some different tools, things to share digitally.
Sounds like a great tool. Thank you. All right, I am going to hand things over to Mark, who's going to share a little bit about kind of some updates on how the circumstances have evolved over the past year and a half with COVID. So Mark, I'll hand it over to you.
Yeah, thank you. And so before I did that, I just wanted to kind of circle back around, again, for those of you that have joined us for the 4 sessions that we're involved with here. Remember, we kind of set out on this journey 4 weeks ago today, talking about this recruiting for retention hierarchy and how in rural and underserved areas, if we can kind of build this foundation, we can work ourselves all the way up into unleashing kind of that most powerful tool that Christine talked a lot about, of showing the real actual people that are living and working in your community, all of those awesome stories that can't be easily replicated in larger urban areas. So again, we started off with that recruitment process, building the foundation that everything else is built upon, that recruitment team, who answers the phone, how are we following up, how are we documenting those things. Then moving up from there, what sort of factors motivate candidates to come out to us? So remember, we went through those different factors, scope of practice, geographic factors, economic factors, and can we identify those unique selling points that make us stand apart from our competitors in a positive way? And then also on the flip side of that, what sort of challenges or barriers did we identify, and what sort of solutions exist to kind of lessen the impact of those things? And then Christine just did a really awesome job of how do we take those things once we've identified, once we have our recruitment process in place, once we've identified those factors that make us unique, what are some free and low cost ways that we can strategically market those advantages that we have to candidates that it matters to. So again, we talked a lot about generational differences. How are we identifying people that geographically or generationally or demographically could fit our positions? And then again, because we're running out of time, just with the number of sessions, we're not going to get too much into regeneration. But as we mentioned at the beginning in the first session, we are doing a whole nother webinar series this fall that all of you will be able to attend for free. That is all around this idea of retention or regeneration. So not only retaining those that you currently have, but how do we continue to kind of grow that pipeline, identify folks within the community that we can kind of guide through training, succession planning, those sorts of things, to not just retain people, but to actively kind of regenerate and cultivate future generations of workforce folks. So again, we're not going to be talking about that a whole lot today in this session. We kind of ended today with the strategic marketing, but just know you'll be invited to attend an entire series on this concept of regeneration, which then gets us all the way up to unleashing our culture. So for our Ask an Expert today, we were going to be talking about recruitment and retention impact of COVID-19. And instead of Ask an Expert today, you are getting Ask an Expert that asks the expert, because I'm subbing in for Michelle Varcho, who is unable to join us today. So again, certainly, as Christine mentioned, you guys are all the experts of your own community. All of you guys lived and dealt with this firsthand. So if there are anything that you'd like to share from your experiences for the group, feel free to throw those in the chat box as well. So we've heard a lot about this term, the new normal. So right, this has disrupted us for going on a year and a half, and certainly in my life, you know, I never would have thought that I would have had the experience living, you know, being fortunate enough to live in North Dakota here in the United States, of, you know, just wondering about whether you were going to be able to get groceries from the grocery store, or, you know, just some of those fundamental things that really kind of rocked society throughout those years. And obviously that impacted every aspect of our day-to-day life, but also it impacted how we, especially in the healthcare industry, how we kind of view our positions fundamentally, how we treat our workforce, what our workforce is looking for us at, and then ultimately how we communicate. So with this kind of idea of the new normal, remember that the foundation of everything that we had is still true, right? We talked about this in the first session, these core beliefs of recruiting for retention, that process and teamwork are key. The competition is fierce, right? We are in such a competitive environment that everything we do, all of the communications that we have to be candidate driven. It doesn't necessarily matter what we need, it matters what the candidate needs. So if we're saying, this is what we need from you, right? We kind of need to flip that on its head from a communication standpoint and say, this is what we can do for you. As an employer, this is what we can do for you. And again, you're seeing that in every aspect of the workforce across the country, not just in healthcare. The competition for workforce is extremely competitive right now in every industry, not just healthcare. And you're starting to see some industries, even like in the restaurant industry, fast food, these huge companies are offering higher pay. They're trying to get creative with their ways to incentivize folks to even come and do an interview, or you know, sit down for an application process. So everything that we're doing is so competitive that we really have to make sure that everything we're putting out there is driven towards the candidate. Recruitment is both a science and an art. There's certainly a process that we have to follow, but if it was as simple as just, you know, checking some things off a box, everybody would be good at it, right? And we know that some folks are, you know, some organizations and some locations have, you know, a better time or easier time recruiting than others. So how do we identify the scientific aspect of it to make sure we're following a process, but then how do we, kind of add some creativity to that using our unique selling points, using our strategic marketing to put our best foot out there. People and tools exist to help. This is one of the most important things for me. Again, we're all on this call because we care about taking care of patients in rural and underserved communities. We're all setting out, 2 hours out of our day to be on a Zoom call here. So again, you're not in this alone. There are folks out there, both at the state level and the federal level, that are there to help you. So I'm just going to launch a poll question here. So how has COVID-19 impacted your workforce? And actually, let's skip the poll question. If anybody has any thoughts on this, just go ahead and throw it in the chat box. So what level of has COVID-19 affected your workforce? So has it been greatly, a lot, somewhat, or you've been fortunate with little impact? So again, keep that in mind as we're going through the next few slides, and feel free to throw your comments in the chat box. So when we're looking at kind of this new normal, right? We're looking at our workforce. We're talking about essential workers. So who are our essential workers that were coming in that really never got a chance to, work from home? And then when we're moving forward from that, those folks that were able to work from home, probably a lot of us in the HR recruiting world, we got used to working from home. So Christine and I, working for 3RNet, we've worked from home for 8 years. And I think for me, if I suddenly had to go back to an office, it would be a huge culture shock for me. It would be I don't know that, again, from just even a personal level, it would be a huge shock to my system. And again, that's after 8 years, but even after doing it for 6 months or a year, now we're asking people all of a sudden that have acclimated to working from home. How are we asking them to come back? Are they going to continue? What sort of ramifications does that have? And again, how does that impact with the essential workers, right? Our clinicians, some of our other folks that can't do their jobs from home. So how do we have that kind of stigma between folks that we need to be physically somewhere? We also have folks that, again, would maybe prefer to continue to work from home. And how do we separate kind of, again, the consequences of those two folks? And then ultimately, again, looking at some of your guys' comments in the chat box here with all of the impacts. I know many of us probably had to go through just really terrible things like layoffs and furloughing people. And again, it was just a really odd time, about this time last year when we were very, very concerned as a country and internationally across the world about healthcare infrastructure and healthcare capacity to take care of all of these sick people. But then at the same time, we were having to lay off and furlough people within the healthcare industry. So it was a really interesting kind of dynamic. And again, what did that mean at the time? How did that impact kind of the way that our healthcare professionals view us? But then also, how does that have kind of a lasting impression going forward? Are folks going to, for example, be leaving the healthcare industry after their experience here in COVID-19? So there are a lot of things to consider as we continue to move forward with COVID. So with some of the unique selling points that we talked about, maybe COVID gave you unique insight to find some additional unique selling points, right? So maybe you develop some really good safety protocols, or again, the chance for certain of your, now that we have kind of a proof of concept potentially that remote work or working from home can work, whether it's full-time, part-time, kind of a flexible schedule, were you able to identify some successful strategies that would help you, communicate better or attract different healthcare professionals, potentially stress management, culture? We've talked a lot about loyalty programs. Also, just there was a lot of information coming out, again, about this time last year, maybe even a little bit before, about folks kind of fleeing urban centers and looking more towards rural areas as maybe a more attractive option. So again, has that happened in your community? Have you noticed an influx of interest in your rural and underserved communities? And again, did we gain kind of any silver linings from COVID that can help us recruit and retain better in the future? So Christine talked a lot about job ads. So it's our first impression. We don't want to use a job description, right? A lot of us, we have a job description as an HR kind of function. But again, everything, all of our communications, we want to be candidate driven. So how do we kind of take that job description and spin that around so that we're showing the candidate, or we're telling the candidate what we can do for them? We obviously want to make it visual and then mobile friendly as well. Looking at our website traffic on 3RNet, again, we're a job board. Essentially at a huge level, we have about 3,500 active jobs at any given time. There's over 70,000 candidates registered with us. So we have a lot of folks looking for openings on our website, and about 50 to 60% of our traffic comes in on mobile devices. So if your job postings aren't mobile friendly, if it's not easy to apply on a mobile device, again, you're losing a significant amount of your potential candidate traffic. So our job ads, again, we talk a lot about this, links to other sites, sample videos. Again, another call out to check out that video that was produced on Fiverr in the chat box. It's really cool for 30 bucks. Again, there are all sorts of things. We have little whiteboard videos on our website, 3rnet.org, that we've produced using Fiverr. Really, with the way that we communicate now, especially with social media and things, people are used to seeing selfies. People are used to seeing short little recorded videos. I'm not a social media guru myself, but I have a young daughter who tells me all about things like TikTok videos and stuff like that people are used to seeing. So again, we're not talking about spending tens of thousands of dollars on a professionally produced, video, but what sort of things can we find that help us spread our message? Photos, maps, and again, making it mobile friendly. Our application process, what sort of barriers exist? Is it easy to complete on a mobile device? What is our call to action? How can we use third-party plugins like Jotform or other things to make it easy for folks to let us know that they're interested? And then also, more importantly, once we do find out that they're interested, how do we have systems in place to make sure we're responsive to what they're asking? Being just aware of your general web presence. So Googling yourself, your company. So what comes up? We do a lot of different website audits for healthcare employers, and a lot of times they're very unaware of what comes up in what we call kind of search engine optimization, or SEO. So if you just Google your company, have you claimed your site on Google, for example? Do you have a bunch of good reviews or possibly negative reviews? What comes up about your community? What sort of other things can you include on your website to link to additional resources? We're talking about your first impression, especially in this kind of we can't even say post-COVID, because we're still we're not post-COVID yet, but how in especially this increasingly digital world, how can we make sure that we're aware of what's out there speaking to us? And again, we're never going to be able to control all of the things that are posted or said about us on different platforms. But of course, the first step in making that better is to make sure that we're aware of it. So again, you have reviews on Google that you can reply to. If you claim your business on Google, you have even a little bit more control over what's displayed. And folks can also leave reviews on things like LinkedIn, Indeed. So if you haven't checked out what people are saying about your organization, or specifically working at your organization, make sure you tap into those. And again, from the folks that are already working within your facility, how can we spread some of their positive stories on social media, on your website? Testimonials, right? When you go to Target.com or Amazon, I would almost guarantee you that the reviews on a certain product impact your decision whether to buy it or not. And those testimonials that you can find or that you can share on your healthcare facility, those are your reviews. Those are things that people are looking at. So again, make sure you're sharing those positive stories. So interviewing, I know you guys are going to be talking about some behavioral interviewing questions next week. Did you have to do this in virtual formats? How did you do that? What is your kind of preferred platform? And certainly establishing communication preferences, making sure that folks are comfortable with that. Understanding generational differences, again, having just a dedicated area that you can do that. Making sure you're prepared. Again, if this is your first kind of quote unquote face-to-face with a healthcare professional. Make sure you're not getting interrupted. Make sure your phone's not ringing all the time. Make sure that you're just setting yourself up for success and dedicating your time. If it takes an hour to interview somebody virtually, make sure that you're giving them your complete attention for that full hour, to again set that standard, that what you're doing and what they're taking the time to do is very important. Site visits, again, during especially the midst of COVID, I'm sure many of us weren't even doing site visits, or maybe doing virtual site visits. We saw in some larger urban areas, people were doing even like site visits through like virtual reality. But I mean, even something as simple as walking around with a phone, making sure that you have current videos, documentation, photos of your existing facilities, the equipment that you have, any sort of virtual tours you can do. If any of you guys are tapped into the real estate market or have been looking to buy or sell a house, you'll see a lot of times now any sort of houses that are listed on the MLS come with like a virtual tour where you can kind of get the sensation that you're walking through. Again, that might be beyond our kind of technological means, but what are some solutions that we could find to make sure that people are getting the best kind of information they can about our organization, about our community through a virtual sense. Again, the site visit might be all virtually, and what does that mean? But again, hopefully as we continue to move forward, we can at least get back to more of a hybrid version where we're sending people information virtually, but ultimately, hopefully we're still able to get them back physically face-to-face walking through our community. So again, some ideas for the on-site visit. Can you find times if it's slower, downtime to take them through your facility, giving them a tour. Again, you might have had to do this during kind of the highest periods of COVID, where you maybe even just communicated with them through a phone, and then using a picture of your facility or your logo or something like that as a background on your Zoom calls. I'm not sure, Christine, if you have one handy, if you want to show folks one of our new branding backgrounds. So again, we all, typically we're just showing kind of the back of our office right now or something like that. But again, if you're doing a lot of stuff on Zoom with a healthcare professional, you might want to invest in creating a little background. Again, something I'm sure you could find on Fiverr that shows your healthcare facility or shows your logo, something like that. So just a few last things, and you can see Christine now put our new ones in the background of her video there. So just something that looks professional, has our branding, something that you can easily do if you're doing a lot of Zoom stuff. So again, just kind of in closing here, what can we do? We want to make sure we keep mental health a priority, obviously. It's a tough time for everybody. And again, unfortunately, certainly that's not over. And I think what we want to do, especially considering, remember, what sets us apart in rural and underserved areas is our employees aren't just a number. We care about them as a person. We care about the patients that we're serving in our communities. So we have to make sure that their mental health and their overall well-being is a priority, right? They're not just somebody that comes in, punches out. Again, this is what sets us apart, the culture that we've developed in our rural and underserved areas. We definitely want to make sure in trying times like this that we go even further to take care of our employees and our patients. So communicate, flexibility is key. Again, adjusting potentially policies, especially when you've had to do things like furlough and lay people off. What sort of communication can you have like that to your employees if things like that were necessary in the past? Probably a good time to update your policies and make sure you're aware of different things that I'm sure all of you guys have went through already. Scheduling routine check-ins, just making sure that you're giving your employees a chance to vent, hear what they're going through, make sure you're supporting them in any ways that you can. Again, this was really a time where we saw certain healthcare facilities that really struggled. All of us really struggled. I shouldn't say it like that, but there were certain instances I worked with different healthcare facilities that went to extraordinary means to be able to not have to furlough people, not have to lay off people, or even if they did have to do those things, they did so in the most, kind of rural way you possibly could, right? Again, and I don't know a better way to say that than we take care of our folks. Again, we're not just a number. So how can we kind of be, have empathy and work with our employees to make sure that they know that we care about them, not only as an employee, but as a person. And then how do we also then communicate that culture, those reviews, that feedback to our external folks. So just some final takeaways here. Obviously, COVID-19 has changed your working landscape. COVID-19 has changed a lot of things. Our first impression is certainly going to be, for the most part, virtual. How do we put our best foot out there, leveraging not only what we have within our organization, but also as we do here at 3RNet, like Christine said, there's only 4 of us. How do we leverage through a very low cost budget outside folks to help us, and remembering that there are not only for-profit businesses and web services like Fiverr or other things to help us, but there are also local nonprofit contacts like our State Office of Rural Health, our Primary Care Office, our partners at Delta, our partners at 3RNet here. There are folks out there, again, that have a passion and a mission to help you do the things that you're doing better. Employee engagement is about trust, building that trust, and investing in challenges. So that is everything that we wanted to cover here and wrap up. I'm going to stop sharing here because I know we have a few last minute poll questions to answer. But again, I'll keep an eye on the chat box and we'll make sure certainly that we leave you guys with our contact information. So even though this is the final session that Christine and myself and Mike and Michelle will be involved with from the 3RNet side of things, please know that the partnership and the dialogue doesn't have to end here today. We're always here to help you. And again, we'll make sure that we leave all of our contact information for you guys in the chat box. So thanks, Shannon.
Thanks, Mark, and thanks, Christine. If you have a question for either Mark or Christine, just feel free to put it in the chat. And like Mark said, this isn't the end. We can always get a hold of them if you've got a question or a question about a resource. And Gwendolyn, we will get those slides to you so you can have all those great tools that Christine shared. So I just want to thank the 3RNet team. You know, you guys are small but mighty, and it's kind of amazing how the depth of information that you all have, as well as just the variety of knowledge that you have. So thank you so much for joining us. It's been really great to partner with you on this series. And our thanks to Mike and Michelle as well. We look forward to seeing you next week, where, as I mentioned, the whole session will be devoted to sharing and learning, recruitment, retention, engagement, culture-related practices from your fellow Delta program peers. So we wish you all a wonderful day, and we will see you next week for our last session. Thanks, everybody.